I would say coming to Africa makes you want to come again.
The world we know, but we don't realize, is getting smaller and smaller.
We feel very happy when doctors come to share their experience with us.
As women's health goes in a country, so goes the nation. Medicine for Humanity is an international medical care and teaching organization aimed at improving the health of women all around the world. We have teams that travel to underdeveloped countries where the need is truly great. And as we travel, we have learned that if we simply go there occasionally, we may not have made as much impact as if we can focus on education as well.
To advance the goal of educating medical personnel in underserved regions, Medicine for Humanity has forged a unique partnership with the David Geffen School of Medicine at UCLA. Dr. Gautam Chaudhry, chair of the Department of Obstetrics and Gynecology, initiated a credentialed rotation so that OBGYN residents can travel with Medicine for Humanity as part of their residency training.
What do we give them for
There's no question, the residents just love it. When our junior doctors who were in training went there, they appreciated the problem much more. They knew the needs, they knew how lucky they were. They knew that, my God, we can't waste things because the third world country doesn't have these things. So they've become much more aware. And I think it's really given them a different perspective.
I think the UCLA residents are incredibly privileged to have the opportunity to come to Eritrea and not only improve their surgical skills, but also have cross-cultural interactions with both the nursing and the physicians who practice here.
Our department, the Department of OBGYN, sends residents and attendings here to teach not only the medical students in lecture format, but also to teach the doctors here newer techniques, more complicated surgeries. And then for the residents, it's a great surgical experience.
As the program evolves and the medical students start to get clinical training, it'll be very good for us to be here and be able to teach the medical students some more clinical aspects of medicine.
Okay, and then put that.
Medicine for Humanity's dedicated and diverse group of volunteer physicians has helped countless courageous women across many borders since 1995.
I think awareness is a very important aspect of this, to know what is women's health care like in Uganda, what is on ground, what are the milestones, how far have they come, what are their challenges, where are they doing well, where can they be helped. The women are seemingly at the forefront because of the virtue of the fact that they are women. They're going to give birth to children, so they'll be the first people to need health care when they're coming to give birth, because maternal health and infant health are the markers of the quality of health care. For example, we've had a surgical camp. We've had this collaboration with MAST and UCLA. And you have come and you've seen what's on ground. Sometimes if we live here and no external force comes in, you sort of like, you get immune, you get to know your situation and you just live with it. But getting other people coming in and, like now the way you came in with a camp, I think that really helps.
There is a lot of exchange of ideas and thoughts about how we can move forward as a group, because I think for both of us, the Mbarara University and UCLA, we both have the common goal of improving the lives of patients.
It's very interesting because we get to see so many different techniques, like surgical techniques and approach, because like you're bringing doctors from the world where they have lots of things to use, and then we come in a world where we have like less things to use. So we interact. It's very good. And Dr. Amy always jokes with me, Billy, you have to hold this. It's like, you have to do it. But this is very good because you can learn the wrong way. And I think that's what we need most. If you equip me with the knowledge and the skills, then you have equipped me with everything.
Prostaglandins, which initiate labor. Are we together?
Medicine for Humanity plans to maximize the resources available in this 21st century to launch a series of internet-based distance learning programs aimed at offering up-to-date medical training and education to doctors and nurses in underserved countries.
Certainly we have some of the most promising partnerships that one could ever desire. Certainly we have the acceptance in the developing countries, and we think we've got a vision for the future. The vision is not to build new buildings or to keep sidewalks clean. It is to create new education.